everyone, and welcome to another live stream of Histology 101, where we talk all things let's try that again. Hello everyone, welcome to Histology 101. I'm Dr. Jamie Chapman, where we talk all things histology, everyone's favorite subject in medicine. Today's live stream, we're going to be focusing on the histology of the urinary system. So we'll be looking at the kidneys, the ureter, the urinary bladder, and then if time permits, we might move on to the early parts of the reproductive system of those people assigned female at birth, and by having a look at the ovary if we get time. And in the next few weeks, we'll be having a look at things like the rest of the reproductive tract of people assigned female at birth, and then the reproductive tract of people assigned male at birth. So we'll be having a look at the testis and epididymis and all that sort of stuff. And then we might have sort of a summary type of live stream where we might do some quizzing, perhaps some Kahoot quizzes, and I'll put up some pictures and ask questions, and we can do a nice little bit of revision of the gastrointestinal system, the urinary system, the reproductive systems. So that'll be coming up in the future. So first of all, let me just thank Lucy S8. Thank you very much for the follow. I really appreciate the follow. Please come say g'day in the chat. If you've got any questions, of course, please type them in the chat. I'll try to keep an eye on that and see how we go. All right, so let's start by having a look at this section. So this is a section of the kidney. Now, it should be noted that the kidney of a rat or a mouse is a little bit different to the kidney of the human. So a human kidney, I might just quickly grab my drawing tablet here. So if you just sort of bear with me. So a kidney of a human, of course, has lots of different lobes. So if we sort of think of a lobe, the kidney as consisting of these minor calyces as part of the then major calyces, something like this, and I apologize because I'm not a very good artist here, but then each of these calyces, these are the minor calyx. I'll write that up here. So here's a minor calyx, and each of these minor calyces actually drains a lobe of the kidneys, and then this structure here, which drains several minor calyces, is a major calyx. Okay, so you can sort of imagine these structures here. So these are the renal pyramids, or the medullary pyramids. Let's imagine our kidneys coming out here, like so. And so a lobe of the, in a human kidney, a lobe consists of, I'll just quickly change the color here. So a lobe consists of the medullary pyramid and its overlying cap of cortical tissue. So here's our cortical tissue. Here's our medullary pyramid. So normally these are quite pyramid in shape, so the base being close to the cortex, and then the apex of that pyramid projecting down and being drained into this minor calyx. And so here we actually have the human kidney, and has multiple lobes, whereas the rodent, the rat or the mouse, which is often what we have to look at, and so this is the histological section of a rat here, only has one lobe. So there's one calyx here. You can see the calyx here, which is going to be collecting the urine, which is forming here. And then we've got all this cortical tissue on the outside, and then here's our medullary tissue. You can actually see just sort of this staining difference between the two regions there. So then we can actually find different components within the cortex versus the medulla. Now the medulla actually has these little extensions which sort of extend out into the cortical region, and these are known as medullary rays. And you might be, even at this magnification, be able to make out some of those extending out. So these are the medullary rays. That's the medullary ray. And then the structure in between we actually refer to as a cortical labyrinth. And of course, that happens to be one of my favourite movies in the entire universe, is Labyrinth, of course. But that's another discussion for another live stream. And then we have, of course, this other tissue here, which is sort of an extension of the cortical tissue down between in these areas of the medulla. And these are known as the renal columns. So these renal columns are basically extensions of the cortical tissue down into this region, which we typically would probably identify as the medulla of Rim. So this is a renal column here, and then this is the medullary pyramid with the apex there. So it's kind of like we have these sort of, in a normal sort of gland, we have like the outer cortex and then we have the inner medullary region. But in the kidney, there's a bit of crossover between those two regions. So in terms of the medulla projecting out into the cortex, we have those medullary rays, these structures here. And then parts of the cortical tissue extend down into the middle part of the kidney, which we would typically expect to be the medulla, and those are the renal columns, but they're actually made up of cortical tissue. So they have the typical sort of cortical tissue like the nephrons, and they all sort of eventually sort of lead back and drain into the large collecting ducts in that region there. Okay, so this area here is normally filled with adipose tissue, fat, lymphatics and blood vessels and so on. Of course, we've got quite a complex blood supply here as well, and we can talk about that if anyone has any questions along the way. All right, so so that was sort of just setting the scene between the histology of the human ovary versus the histology of the rodent ovary, which is what we're looking at here. So multiple lobes in the human ovary, just one lobe in the rodent lobe. Did I say ovary? Kidney, sorry. My brain's not quite entirely switched on today. I apologize for that. All right, so as I mentioned, here's our renal pyramid. So here's the apex. We've actually got these big, large collecting ducts emptying into here. So our urine drips out. It's collected by this calyx here. And this calyx is going to be the first part of the urinary system where we actually find urinary epithelium or transitional epithelium. But let's start with the outside. There's normally a connective tissue capsule on the outside, although that's not always present in a histological section. If we sort of zoom out, we can kind of get this impression of this distinction in the cortical tissue. So this is sort of cortical tissue just out here, of these sort of bands within the cortex of the kidney. We've got these stripy bits here. These are the medullary rays, and the medullary rays are sort of extensions of the medullary tissue out into the cortex. And they contain collecting ducts, but they also contain the loops of Henle of the nephrons. So they're found in those regions there. So the medullary rays contain the collecting ducts and the loops of Henle. And then this, in between these medullary rays, these are the cortical labyrinths. And in the cortical labyrinths, we actually find the renal corpuscles. You can see some of them here. There's one here. And then around those, we find the renal tubules in the forms of the proximal and distal convoluted tubules. And of course, there are associated blood vessels within that region as well. And so we've sort of got these, interplay between these different components. Now, of course, it is the whole function of the kidney is sort of homeostasis. It plays a really important role in a variety of different homeostatic mechanisms. One, of course, is fluid balance, electrolyte balance, things like that. And so they do that through a process of filtration and absorption and secretion through the nephrons which exist within the kidney. Now, in order to actually understand that, we actually need to actually understand the blood supply quite well for understanding how it actually works. So we do have, let me just sort of quickly talk about the blood supply before we sort of move on and have a look at more detailed histology here. So this is just going to be a really quick flow diagram of the blood supply which exists within the kidneys. Our first, of course, the first blood vessel is our renal artery. And so from the renal artery, we then get branching segmental arteries. They then branch into interlobar arteries. And they sort of, if we remember the sort of structure of, we've got our minor calyx, and then we've got our medullary pyramid here, and then we've got our cortical tissue. The interlobar arteries sort of run up this way here. Okay, so this would be our interlobar blood vessels, these ones here. Now then they take sort of these little right angles at the junction between the cortex and the medulla, and these here, these are actually the arcuate vessels. So these are the arcuates. So the arcuate arteries are found in that region as the junction between the cortex and the medulla. They then send in these blood vessels into the cortex, like so. And those are known as, there's two names actually, interlobular arteries, and some textbooks actually describe them as cortical radiate arteries. So from the interlobular arteries, we then get to the afferent arterioles. From the afferent arterioles, they supply the glomerulus, which is our capillary tuft, glomerulus. From there, we then go to our efferent arterioles. Can we actually see? That says efferent. Believe me, it says efferent. I'm just going to disappear here. Let me go. I don't have a little thing for it. Hang on a second. There we go. Efferent arterioles. And then the fate of the next blood vessel depends on where we actually find the nephrons. So if we have nephrons which are mainly cortical, sort of out here in this region here, so we actually have the nephrons out here, then these are known as cortical nephrons. But sometimes we can actually have nephrons which exist near this junction between the cortex and the medulla, and these are known as juxtamedullary nephrons. So we've got juxtamedullary nephrons. Okay, so juxtamedullary nephrons actually have very long loops of Henle that extend down into the medullary region there, and they're responsible for sort of the very fine control of urine in terms of its concentration. So if you want to dilute urine or you want a highly concentrated urine, then the juxtamedullary nephrons help to regulate that. The cortical nephrons, the ones out in the outer cortex, are more about just the bulk urine production. So we have cortical nephrons out here, and then juxtamedullary nephrons near that juncture between the cortex and the medulla. Now, if we're talking about cortical nephrons, then the next blood vessel that comes are the peritubular capillaries. And the peritubular capillaries are actually the ones which collect all of the reabsorbed nutrients from the proximal convoluted tubules and some of the distal convoluted tubules. If we're actually talking about the juxtamedullary nephrons, then these actually become long blood vessels that follow the nephron loop or the loop of Henle, and these are known as vasa recta, or the straight blood vessels. And it's from there we eventually get back to or drain into the cortical radiate venules, or the interlobular venules, then to the arcuate veins, to the interlobar veins, and then into the renal vein. So we don't actually have segmental veins. Okay, so that's the blood supply. And you can think about it, if we know the sort of normal cardiovascular way in which the blood vessels run, we normally go from an artery to an arteriole to a capillary bed, then to a venule, to a vein, and so on. But here we actually go from an artery to an arteriole to our capillary bed, then to another arteriole, then to another capillary bed, and then to our venules and so on. It's quite a very unique arrangement of blood vessels here. Okay, so does anyone have any questions about the blood supply? So that's the sort of flow diagram of the blood vessels within the kidney, starting from the renal artery and eventually collecting via the renal vein. So of course the glomerulus is where we get filtration happening. Filtration. Yeah, okay. So there's no questions in the chat there. So then let's go back to our, let me just close this. Go back to our histology slide here. Right, so, and I'll come back on screen. Hello, I'm back. Yeah, so I'm just going to sort of zoom out again so we can get re-established about what we're looking at. So again, here's our renal pyramid, here's our medullary region, here's our cortical region, and we were sort of just beginning to have a look here at the cortical tissue. Now these vessels here, you can see these vessels, these are actually near the junction between the medulla down here on the left and the cortex out here. So these are actually arcuate vessels. Remember, they occur at the right angles between the junction between the cortex and the medulla. So if you see these large vessels here, look, we can see here, little artery here and the vein here, these are actually the arcuate vessels, and then they're going to send up branches of the interlobular or the cortical radiate blood vessels, and some of these might be out here. Okay, so those are really sort of good things to look at to sort of work out where you're looking, trying to distinguish between the junction between the cortex and the medulla. All right, so if we go out to the cortex again, we've got these medullary veins, we've got our cortical labyrinths, and within the cortical labyrinths are where we find our renal corpuscles. So we can actually see a renal corpuscle here, and then our proximal and distal convoluted tubules. So we sort of zoom in here. Trying to identify the cell types in this section is a little bit tricky. You really need sort of a nice resin section to help identify the different regions. But generally, the nephron consists of the Bowman's capsule and then the glomerulus. So the glomerulus are the capillary loops, the capillary bed here, and the Bowman's capsule consists of two components. It consists of an outer parietal layer, which are these simple squamous cells here. You can see the nucleus of this one here. So they form the capsule, and then sitting on the surface of the capillaries, like this nucleus here, this is actually known as the visceral layer of Bowman's capsule, or they're known as podocytes. And they sort of envelop and wrap around the capillary loops themselves, and they're sort of like Homer Simpson grabbing onto Bart Simpson's throat, like, "Why, you little?" And so the fingers of Homer's fingers of Homer wrapping around Bart's neck are the foot processes of the podocytes, and so these are known as pedicels. And so the pedicels sort of envelop the blood capillary. So we sort of look at that. If we imagine that my fingers are the pedicels, you see there's little spaces in between my fingers. And those spaces actually represent the filtration slits. So they're the little spaces between the pedicels, and they're a component of the glomerular filtration membrane. And extending between my fingers, if these were the pedicels, are little membranes, and those are known as the glomerular or filtration slit membranes, I should say. So we have those two layers to the glomerulus, the Bowman's capsule. We have the parietal layer, the visceral layer, or the podocyte layer, and they envelop around the outside of the capillaries. So we have a look out here. We can identify, so for example, this nucleus here you can actually see as part of the capillary loop, or I hope you can see as part of the capillary loop. I don't know how easy you can see that. I sort of might see if I can make it a little bit bigger here. Okay, and if we can sort of zoom in. Yeah. So this nucleus here belongs to the endothelium that makes up the glomerular capillary. And that's actually a fenestrated type of capillary, and so it has little openings, and then the filtration membrane sort of, the glomerular filtration barrier is this sort of movement of substances from the capillary lumen out into the urinary space, or the Bowman space, which is this space here. Now, the more rounded cells on the surface, those are the podocytes, and then some of these cells inside here sort of secrete an extracellular matrix, and these cells are known as mesangial cells. And mesangial cells are sort of like modified connective tissue cells. They secrete an extracellular matrix called the mesangium, and that helps to sort of bind everything together. But they're also very intimately associated with the capillaries there, and they have cytoplasmic extensions which extend out into the endothelium, and they actually can become contractile and actually affect the constriction and things like glomerular filtration rate and things like that. So that's the nephron here, the renal corpuscle. So remembering this is like the first part of the nephron. So the blood is filtered here, it enters into the urinary or the Bowman space, and then it migrates out into the proximal convoluted tubules. So this is a proximal convoluted tubule here. Now the proximal convoluted tubule is lined by a simple cuboidal epithelium. You can see the nice round nuclei of our simple cuboidal epithelium. You can see its lumen is quite indistinct, very difficult to see, and that's because these cells have a very well developed brush border, which of course they use to increase surface area for absorption. So most of the filtrate is actually reabsorbed by the proximal convoluted tubules, so almost all of your glucose, almost all of your amino acids, many of your electrolytes, most of your water is actually reabsorbed by those proximal convoluted tubules. Now, you might see these structures over here. This is actually the distal convoluted tubule. Now, how do we tell the difference? Well, firstly, there's generally more mitochondria in the proximal convoluted tubule, and this tends to make the proximal convoluted tubules a bit more acidophilic and staining, much more sort of brighter pink. Whereas you can see here, the distal convoluted tubule certainly not as pink, nor certainly not as robustly pink. It's just more of a pale type of pink. The other nice way to tell is we can actually see a much clearer lumen. We don't have a brush border on the surface of the distal convoluted tubules. They do reabsorb primarily sodium, and water follows down that as well, but they do have the basolateral membranous infolding, so they do have basal mitochondria to help move substances against that concentration gradient. So what you're looking for is if you can see this sort of slightly paler pink staining, not a very, certainly a more clear lumen, and these are the distal convoluted tubules. So you can see here quite a nice lumen in comparison to here, for example. You can barely see the lumen here because of all the microvilli present. Okay. So those are the main features of the renal corpuscle and the proximal and distal convoluted tubules. You remember that the blood supply comes from the afferent arteriole. It brings blood to the capillary bed, and then it's carried away in the efferent arteriole. So here's one of the blood vessels out here. But you know, trying to distinguish between the afferent and efferent is a little bit tricky. You need a really nice section here. And this has got nice examples of our parietal layer of Bowman's capsule out here. And then any sort of more rounded cell on the surface would be part of our podocytes. Okay. So here's our medullary rays. They're collecting the filtrate that's actually being created within the cortical labyrinths, the nephrons within the cortical labyrinths, and then they carry down that urine down into the medullary region, and we have all of the different sort of subcomponents of the medulla here. Now, for my students, I don't expect them to distinguish between the different components here. Any blood vessels here, of course, are largely going to be the vasa recta, which is sort of collecting the materials being absorbed here, and then eventually these coalesce into these large collecting ducts. So I want to zoom out a little bit. So that we move down. You can see these very large collecting ducts here, eventually draining down at this renal papilla here. These are very pale staining cells. There are two main cell types in the collecting ducts. Those are the principal cells, and they have a single individual cilium, and then the dark cells, or the intercalated cells, and they're responsible for modulating hydrogen ion secretion and modulating the release of or regulating pH, blood pH there. So here we can actually see sort of the openings where the large ducts here. These are known as the ducts of Bellini. That's the eponymous term. I apologize, I'm not 100% sure of what the non-eponymous term is, but here's our minor calyx, and as I say, the minor calyx is our first instance of actually having the urinary epithelium here. So this is the first time that we actually see the urinary epithelium, transitional epithelium, lining the calyx here. Okay. So I'm just going to have a quick zoom around. I'm just going to see if I can see any macula densa, which we might be able to see, and we can talk a little bit about what that looks like. So the macula densa is part of a component known as the Juxtaglomerular apparatus, which consists of three components. Macula densa is one of those components, and the macula densa is actually rubeosa glomeruli only found in the cortical tissue. Yeah, so they're only found in the cortical labyrinths. So if we sort of talk about the distribution of the nephron, so we start off, of course, with our nephron, our renal corpuscle, then that drains into the proximal convoluted tubule. Then we have our loop of Henle, which consists of a thick descending part, a thin descending part, a thin ascending part, a thick ascending part that then becomes continuous with the distal convoluted tubule, then a collecting tubule to a collecting duct. So of those components, within the cortical labyrinths, we find the renal corpuscles, the proximal and distal convoluted tubules, the loops of Henle are found, and the collecting ducts are actually found within the medullary rays. And then within the medulla, we only find the loops of Henle, thick and thin limbs, and then also the vasa recta, which follow those as well. And of course, the collecting ducts are found within the medullary region. So glomeruli, remember, it's not just a glomerulus, it's a renal corpuscle, because it's not only just the capillary tuft, but it's also the Bowman's capsule, which consists of the parietal and the visceral layer as well. So glomerulus is just one part of the larger structure of the renal corpuscle. But absolutely, it's found in cortical tissue, so hopefully that helped you out. So I was talking about the juxtaglomerular apparatus. It's a really important functional component of the kidneys in that it helps to regulate blood pressure. Now, the juxtaglomerular apparatus consists of three components. One of those was the macula densa, which I was just beginning to talk about. Would you please be able to explain that one more time? You mean stimulate my follicle? Do you mean the distribution of the different parts of the nephron? Is that what you mean? Do you want me to explain that one more time? Yes, okay. So there's a macula densa there, but we'll talk about that in a second. Okay, so if we think about the nephron, so if we imagine so here's our kidney, here we have our medullary rays. Sorry, I shouldn't have touched that. And then we've got our renal pyramid. And then we're draining by our minor calyx here. So if we think about the nephron consisting of our Bowman's capsule and our proximal convoluted tubule, we've got our loop of Henle, then our distal convoluted tubule. Whoops, I needed to have continued that. And then that drains into our collecting duct. Okay, so here's our, so yeah, of course we'd have our so here's our renal corpuscle consisting of the Bowman's capsule and our glomerulus. Then we have our proximal convoluted tubule. We have our thick limb of the loop of Henle. We've got our thin descending limb of the loop of Henle. We've got our thin ascending limb of the loop of Henle. We've got our thick ascending limb. So this is the thick descending limb. And then we've got our distal convoluted tubule. We've got our collecting tubule, and then we've got our collecting duct. If I can move that around, apparently I can't. All right, so if we think about where all of these different components are actually found, then here we've got our cortical labyrinths, we've got our medullary ray, cortical labyrinth, medullary ray, and so on. So we've got our repeating pattern of cortical labyrinths and so on. So our renal corpuscles, cortical labyrinth, we find our renal corpuscles, we find our proximal convoluted tubule, distal convoluted tubule, and of course their associated blood vessels. Okay, so we have our glomerulus, afferent arterioles, the interlobular arteries, peritubular capillaries are all found within our cortical labyrinths. Within our medullary rays, we find our loops of Henle and our collecting ducts. Whoa, I forgot how to spell collecting. Oh, I'm still on the eraser. And we'll also find these here, which is the medulla. They're also found in the medulla as well, the loops of Henle and the collecting ducts. So if we think about it, here's our renal corpuscles. They would have their loops of Henle coming down here, then coming back, and then eventually they'll drain back into the collecting ducts in this region here. And so in this way, we can actually sort of subdivide the kidney into lobules. So a lobule is a sort of a functional division of the kidneys, which consists of a medullary ray in the center and then two halves of the cortical labyrinths. Because of the nephrons that occur in this half, all drain into the collecting ducts within this medullary ray. These ones would drain into this one, and so on. So we can actually subdivide the kidney, not anatomically, but actually more functionally, into lobules, which consist of a medullary ray in the middle and half of a cortical labyrinth. University of Mississippi has a beautiful resin kidney section on virtual microscopy database. I'm sure they do, however, I don't have permission from the people to actually use it in a live stream, so I can't actually go to their that slide and actually use it. I'm sorry. All right, so does that sort of help stimulate my follicle? Does that help your understanding about where we find the different components of the nephron within the kidney? So the cortical labyrinths contain the renal corpuscles and the convoluted tubules, and the medullary rays here contain the loops of Henle collecting ducts, as does the medulla. And so, of course, there's you can sort of divide the medulla into an outer medulla and an inner medulla. The outer medulla is where you'd find the thick limbs of the loop of Henle, and then the inner medulla, you might find some thin limbs, as well as the collecting ducts in this region. So they'd have a slightly different distribution of those different components as well. Just a reminder too about the structure of the different regions. The proximal convoluted tubule are characterized by having those cells, but with a very prominent microvilli on their surface. They have lots of mitochondria, and they have those basolateral membranous infoldings, which also have lots of mitochondria as well. So that's the proximal convoluted tubules. The distal convoluted tubules are relatively flat, like that. They have the round nucleus, and they have their mainly basally located mitochondria, because they're moving substances from a concentration gradient against a concentration gradient there. So this is the distal convoluted tubule. Now, the thick descending limb of the loop of Henle is histologically identical to the proximal convoluted tubule, whereas the thick ascending limb, which becomes continuous with the distal convoluted tubule, looks exactly identical to the distal convoluted tubule structure. The simple squamous thin limbs are basically just a nice squamous epithelium. So this will be the thin limb here. Histologically, basically, if an exam question ever came up about the loop of Henle, you're basically asking a question about the proximal distal convoluted tubules, because the thick limbs are histologically identical to the proximal and the distal convoluted tubules. And then you just have the simple squamous lining of the thin limb to discuss as well. All right, so hopefully that helped sort of clear up where we find the different components of the nephron within the kidney. We can go back to this here. And I was talking about the juxtaglomerular apparatus, and the juxtaglomerular apparatus consists of those three components. No worries, great, I'm glad that helped. And one of those was the macula densa. Now you can see, hopefully, here we've got a nice clear lumen. This is the distal convoluted tubule, and here we've got this very dense collection of nuclei, and they almost look columnar in appearance. This dense collection is a macula densa. Now macula means spot, densa means obviously a dense region or a dense spot, and it's because of this high density of nuclei in this region. Now these cells are actually osmoreceptors, and they actually detect levels of sodium within the filtrate that's passing through the distal convoluted tubule here. So every distal convoluted tubule eventually comes back and reconnects with the renal corpuscle that it's associated with, and actually is involved in this larger structure of the juxtaglomerular apparatus. So the macula densa is one component of the juxtaglomerular apparatus. The other component are juxtaglomerular cells, and juxtaglomerular cells are actually modified smooth muscle cells of the afferent arteriole. So if there was an afferent arteriole here, maybe we can draw them in. Oops. All right. So if we imagine that there was an afferent arteriole bringing the blood, oh, that was really bad. So our afferent arteriole is bringing blood in. Here, then there's actually modified smooth muscle cells within the wall, which are juxtaglomerular cells. And they actually secrete renin. Renin plays a really important... Goodness me, my brain is not working this afternoon, ladies and gentlemen. I apologize for that. Here we go again. All right. Okay, so here's our macula densa. And then we'd have our efferent arteriole here. And sort of interspersed in between, we might be able to see some other cells here. And these are known as lacer cells or extraglomerular mesangial cells. And those are the three components of our juxtaglomerular apparatus: our JG cells, our macula densa cells, and our lacer cells, or our extraglomerular mesangial cells. As I say, the macula densa are osmoreceptors, and they detect levels of sodium. JG cells are modified smooth muscle cells. And they're stretch receptors, and if they don't get stretched enough because blood pressure is low or blood volume is low, then they actually release renin. Now, renin is part of what's called the renin-angiotensin aldosterone system, or aldosterone system. I don't know how to say aldosterone or aldosterone, but I say it both ways. So however you want to say it, that's fine with me. Renin is a hormone which is released into the blood. It converts something already within the blood called angiotensinogen, which is released by the liver. Angiotensinogen. So renin converts angiotensinogen into angiotensin 1. Angiotensin 1 then goes to the lungs, and the lungs actually have something called angiotensin converting enzyme, or ACE. And ACE converts angiotensin 1 into angiotensin 2. Now, angiotensin 2 is what brings about all the effects. So angiotensin 2 can actually have a direct role on the blood vessels, so it can actually cause vasoconstriction peripherally, which increases blood pressure. It can also cause constriction of the afferent arterioles and the capillaries to increase glomerular filtration rate. But angiotensin 2 also goes to the adrenal cortex, particularly the zona glomerulosa, and that releases aldosterone. Now, aldosterone actually causes sodium to be reabsorbed from the distal convoluted tubules. And so whenever you reabsorb sodium, you're taking sodium outside of the water, and so the concentration of water is higher than in that filtrate, which means that in an osmotic gradient, water moves from a high to a low concentration. So by removing sodium, water tends to follow the sodium. So when the distal convoluted tubules reabsorb more of the sodium, water is also reabsorbed. And so we actually get more water into the blood. Blood increases its volume, and therefore blood pressure is increased. Now, aldosterone can also bring about some of those constriction events as well. So again, this is all part of this larger system called the juxtaglomerular apparatus, and it consists of these three components. So we've talked about the role of the macula densa. The macula densa detects sodium levels. If they're too low, it means that the tubules have had more time to actually absorb sodium, and so they actually detect low sodium, and then it's thought that they use the lacer cells at some sort of intermediary to stimulate the JG cells to release renin and bring about this sequence of events. The JG cells are the mechanoreceptors. They don't get enough stretch, means blood pressure is low, blood volume's low, they release renin, and that brings about these various sequence of events. So yeah, that's the juxtaglomerular apparatus, and these are the actual component of it, these sort of dense cells of the distal convoluted tubule here. So hopefully that made a little bit of sense. How are we going for time? Okay, so we've just got a few minutes to go. Let me close this. I haven't even had a chance to talk about any of the other components yet. Yeah, well, I think that pretty much covers the kidney here. Unless anyone has any questions related to that, I might see if I can find a section now of the ureter. I think there's a section here somewhere. There it is. Bear with me while we this comes on board. All right. Okay, so the ureter, of course, runs from the renal pelvis, which is sort of the region where all of the major calyces coalesce into a larger pool and form this little basin called the renal pelvis, and then the renal pelvis becomes the ureter. And the ureter consists of 3 layers. It consists of a mucosa, and the mucosa consists of the transitional epithelium. You can see some nice examples of it here. It's a stratified epithelium, and the surface cells are actually quite dome-shaped, and these are known as umbrella cells because they can expand and open up like opening up an umbrella. They have lots of tight junctions between them, which means that this forms a nice waterproof seal. So these cells are called transitional epitheliums because at the moment this is quite a relaxed type of epithelium, but if we were to see an expanded epithelium, these cells can actually expand, and inside these cells they have these intramembranous infoldings, a little bit like a piano accordion, and so they can expand, and then the cells can even appear quite squamous in appearance. But typically in a relaxed form they have this nice round nuclei, these dome-shaped umbrella cells, and it's a stratified type of epithelium. So the mucosa consists of this transitional epithelium, an underlying layer of loose connective tissue. You can see some capillaries over here, and then we've got some smooth muscle in the wall. And initially the smooth muscle consists of 1 that eventually becomes 2 that eventually becomes 3 layers of smooth muscle as you move distally towards the urinary bladder. Now it's a unique arrangement, and certainly if we compare it to the gastrointestinal tract, in that the first layer is actually an innermost longitudinal layer. So if you remember the gastrointestinal tract, the innermost layer was always circular, unless of course we're talking about the stomach and then it was an innermost oblique layer. But most of the gastrointestinal tract consists of an inner circular layer, outer longitudinal layer. Here we have an inner longitudinal layer, so you can actually see these cells are cutting cross-section, so the cells are actually coming out of the screen at you. Then we have the middle circular layer, and then if this was a bit more distally, we would see an outer longitudinal layer. We don't really see a lot of evidence of that in this section, which means that it's probably a section a little bit higher up in the ureter. If this was a bit closer to the urinary bladder, we would expect to see an outer longitudinal layer of smooth muscle. And then we see an adventitia / serosa. Now there's a little bit of controversy out there in the literature about which does it have, and in fact it's likely it has both, because of course if we think about the ureter, it sits on the posterior abdominal wall and the pelvic wall, and it has a part of it which is exposed to the abdominal cavity and the pelvic cavity, and a part which is attached to the posterior abdominal wall. So part of it will have an adventitia that's binding it to the surrounding structures, the abdominal wall, and part of it would likely to have a serosa, which has a simple squamous mesothelium on the surface. This largely looks like connective tissue, so we can see lots of adipose tissue. These are adipocytes here. And I can't really see any evidence of a serosa just at this point in time. So just be aware that different sections may appear a little bit different, but you can see some of the larger blood vessels out here in this blood adventitia here. Nice little arteriole here, a little venule. You can see them sort of branching in here, and they'd supply the blood vessels here. Just be aware too that the loose connective tissue here isn't particularly loose. It's sort of, quite a primitive type of connective tissue. It's quite unique to this region. Okay, so that's the ureter. It helps to move the urine both through gravity but also through peristaltic contractions through the muscular wall. Interestingly, this arrangement of smooth muscle in the wall of the ureter is a similar arrangement that we see in the ductus deferens or the vas deferens. 3 layers of the ureter: mucosa, mucosa, muscularis, and then adventitia. So those are the 3 layers. So here, if we go from here down to here, this is the mucosa. This here is the muscularis. I'm using the mouse here, which is why it's a bit gross. And then here, this is the adventitia. So those are the 3 layers: mucosa, muscularis, tunica muscularis, tunica adventitia. So sorry that wasn't very clear, Ruby. So the mucosa almost always consists of an epithelium, an underlying layer of loose connective tissue, which we would call a lamina propria. So together they form the mucosa, so the epithelium here. You're welcome. And then the tunica muscularis, consisting of those 2 to 3 layers of smooth muscle, and then the adventitia. So as I was saying, the peristalsis helps to move the urine as well. And if you were to look at some x-rays of where they've injected dye into the ureters, you can actually see little constrictions where peristalsis is taking place. Okay. So I don't think I've got any, I'll go back one more. The urinary bladder, so we wait for this to load up. So the urinary bladder is all the way down here. It's a bit of a unique structure of the urinary bladder here. It's not the sort of normal structure that we see, because I think this section's actually been taken more closer to the neck region of the bladder rather than sort of the body region. So we have this very odd sort of folding pattern which we can see here. But again, we do have a transitional epithelium. Here it appears quite extended. You can see some of these cells look quite flattened on the surface. So this looks like it's been extended. So we talked about how it can transition from that nice dome-shaped structure to the sort of flattened type of appearance. That's what we can kind of see on the surface here. Look at this connective tissue, this loose connective tissue. It's extremely cellular. There's not a lot of fibers, not a lot of evidence of fibers. To me, it's very mesenchymal-like, so very much like that primitive connective tissue with lots of ground substance, lots of cells. It's a little bit like the stroma of the endometrium in terms of its appearance here. We can see some blood vessels here, but again, there's not a lot of evidence of fibers here. So this is the mucosa. Again, mucosa consisting of the transitional epithelium, loose connective tissue, and then here's our first layer. Just so the urinary bladder has 3 layers. Remember, this is this smooth muscle of the urinary bladder is called the detrusor muscle, and it consists of 3 layers in the similar arrangement that we saw on the distal end of the ureter: innermost longitudinal, middle circular, outer longitudinal layer. And you can see it's not in those nice bands which we saw in the gastrointestinal tract. There are more in pockets, and it's because it's not so much a coordinated relaxation, sort of peristaltic type of contraction. Of course, when we get the stimulus from the parasympathetic nervous system to void the bladder, then we get this massive just contraction to reduce the volume and force urine out through the urethra there. So again, we've got these smooth muscle cells cutting cross section, so the smooth muscles coming out of the screen at us. This is the longitudinal section. Here we have the inner circular arrangement. We can see longitudinally sectioned nuclei here. And then if we continue out, we end up with cross-sectional smooth muscle again. So we've got an outermost longitudinal layer. And we can see a nice little serosa on the outside here. So we sort of zoom in a little bit. We might be able to see some simple squamous cells on the surface. You can see this sort of definitive line on the surface here, which is typical of a serosa rather than an adventitia. Remembering adventitia is a connective tissue binding it to surrounding structures. Okay, so then we move into the urethra. Now, I don't have any sort of digital versions of the female urethra. I do have some sections of the male urethra. Now, that's not a sexist thing, it's just an unfortunate thing that we don't have. So the male urethra, of course, the first part of the male urethra is the pre-prostatic urethra. That's the part that passes through the neck of the bladder, and of course we get thickening of the detrusor muscle in this region, and that helps to form the internal urethral sphincter. And of course females have the internal urethral sphincter as well, so that thickening is there. In the males, that then goes through the prostate gland, becomes the prostatic urethra. And so we're going to have a look at a section now of the prostate gland. When it finally loads, here we go. So what I'm going to do, I'm just going to sort of rotate it around so everyone hold their lunches in their tummies. Oh, yeah. Hang on, not there. Close enough. All right, so this is the prostate gland. This U-shaped structure here, or upside down U, I suppose, is actually the urethra. We sort of zoom in here. So here's the urethra. We can see this transitional epithelium here on the surface, and we can actually sort of divide, sorry, I can't seem to get that nice region of magnification. Right, so then we sort of, you can see the glandular components of the prostate gland here. We have what we call mucosal glands, submucosal glands, and then the main prostatic glands out here. Now this is sort of leading a little bit into the male reproductive system, or sorry, the reproductive system of people identified as male at birth. And so the prostatic urethra is here. It receives the mucosal. So this point here, you can see the top of the upside down U. This is known as the urethral crest. And then these spaces, these sides here, these are known as the urethral sinuses. And so the urethral crest receives the secretions from both of the mucosal glands here, empty directly into the urethral crest, whereas the urethral sinuses receive the secretions from the submucosal glands and the main prostatic glands, and they empty into these urethral sinuses here. So that's a little bit of a prelude to our look at the reproductive tract of people identified as male. So that's the prostatic urethra. It then passes to the membranous urethra, which passes through the urogenital diaphragm, and that's around the area where we have the external urethral sphincter, so the skeletal muscle. And then we have the penile urethra. And this is a section of the fetal penis. So it's a bit of an odd section, but here we have the two corpus cavernosa, which are the two upper erectile tissue masses, and then down here we've got the corpus spongiosum, and this structure here, if we look at this scary face with the big teeth here, the teeth are actually the urethra. So this is the what's known as the penile urethra or the spongy urethra. This actually starts off as transitional, and as it migrates down the length of the penis through the corpus spongiosum, it eventually becomes stratified squamous, non-keratinized epithelium, eventually becoming keratinized epithelium as it becomes continuous with the skin of the penis near the external urethral orifice. All right. So as I say, this is a little bit of a unique section. It's actually taken sort of a junction near the glands of the penis through there, and so what we're looking at is actually, this is the glands penis here. So remember, we haven't done the male reproductive tract, but those of you who have, the corpus spongiosum has this external swelling known as the glands penis that forms the head of the penis, and this is what we're looking at here. This is the glands penis, then this is the skin of the prepuce or the foreskin, and then there's the skin of the rest of the penis around the outside here. So this is a trichrome stain section, so collagen stained blue here. This is the keratinized layer of the prepuce here. So this is the glans penis. Then we've got our two upper erectile tissue masses. These are the corpus cavernosa, and we've got this thick, dense connective tissue capsule here, which is known as the tunica albuginea. Now we'll see that name pop up many times during our look at the reproductive systems. So we find it in the testis, we find it in the ovary, and we find it within the penis here. So here's another tunica albuginea. Here's our corpus cavernosum, so two corpora cavernosa, and then our corpus spongiosum down here. All right, well that was a little bit of a prelude into the male reproductive tract, or the reproductive tract of people identified or assigned male at birth. I noticed that that's about our time. We haven't had a chance to talk about the histology ovary, so we might carry that over to the next stream, and really it deserves its own stream anyway, because of course it's very high, interrelated with the rest of the reproductive tract of people assigned female at birth, and the concept of ovarian cycle and follicular genesis and the menstrual cycle as well. Thank you very much for joining me. Unless there's any sort of last minute questions, I'm happy to sort of take last minute questions. Otherwise, we will end the stream here. I apologize we never got a chance to talk about the ovary. That can be our clickbait for next stream. You can come along and ask all the questions along. Thank you very much, Amanda. Glad you could come along. You're welcome, Lucy. Thanks very much for coming along, and thanks again for following. You're our newest follower. So many questions, 19. You're welcome. Thanks very much for coming along. Thanks, Menopause Albios. I really appreciate everyone coming along and saying thank you. I always enjoy doing these, so I appreciate you coming along. Thanks very much, Stimulate My Follicle. Yeah, okay, so that's where we're going to end it. Come back next week. I'll try to find a time that's suitable for our second year medical students, and hopefully everyone else can come along as well. And then we'll talk about the ovary and the rest of the reproductive tract of people assigned female at birth. So for those of you who are experiencing Friday, as we are down under, have a great weekend. We'll see you next week, and see you in the next stream. Hooroo!